Hello everyone, I am Dr. Navajit Das, consultant urologist, Guwahati. Today I am going to talk on an important topic, that is transurethral drainage of prostatic abscess. Now, what is prostatic abscess and why is it important? It is important because we have a gland named prostate gland, and we know about things like prostate cancer, benign prostatic hyperplasia, which are common. But sometimes in diabetic individuals or sometimes in patients with severe infection, there might be an underlying prostatic abscess which is not that much detected easily on ultrasound. We go by a clinical suspicion, and in those cases it's very important to drain the abscess because it is fatal if it is not drained in 30 to 40% of the cases. So it is very severe, and it is mostly undiagnosed. That is why we are talking on this topic. Now, prostatic abscess is a localized collection of pus within the prostate gland, which is a part of the male reproductive system. The prostate gland is responsible for the producing the seminal fluid, which nourishes and transports the sperm. Now, here we can see this is the prostate gland. This is the prostate gland, and here the abscess occurs. Now, the causes of prostate abscess are bacterial infection, obstruction of the prostate ducts, complications of prostatitis, or uncontrolled diabetes mellitus. Now, the symptoms are fever and chills, pain in the pelvic region, urinary symptoms, there might be rectal pain, or there might be sexual dysfunction. Now, what is the treatment of prostatic abscess? Once we know a patient has prostatic abscess with an ultrasound or a MRI or a CT scan, or under high clinical suspicion of non-improvement of lower urinary tract symptoms, recent onset symptoms, in those cases we go for antibiotic therapy, abscess drainage, prolonged antibiotic course, and pain management. We will talk today on the drainage. Drainage can be of two types. Sometimes there are multiple small multiloculated abscess. Then we can drain it by the transrectal ultrasound. However, if there is a big abscess, we have to go by transurethral drainage. It is just like TURP, the procedure, and I'll explain it now. So this is the video of transurethral drainage of prostatic abscess. So here, this is the cystoscopy. We are seeing an enlarged prostate, and there is pus in the urine. We are resecting the left lobe. Now we are cutting the left lobe with transurethral resection. We can see the vascularity is very much high because of the ongoing prostatitis. Now, as you are resecting, we will just encounter the abscess. It's a very large abscess which is down in the left lobe. Our idea will be to cut the roof of the prostatic abscess so that the abscess drains into the urinary into the urethra very easily, and it comes out. In that way, the size of the prostate will decrease, and the patient will be able to void, as well as he will have decreased infection as the abscess is drained. Now, we have dissected the left side. Now we will be dissecting the right side. So this is the prostate tissue, normal prostate tissue. Once we go deep, now we will find there is abscess in the right lobe also. So here we are seeing that there is abscess in the right lobe, and we are trying to resect the roof of the prostatic abscess. We try to manipulate by putting a finger in the rectum the prostatic abscess, and break. We try to break also the as much as loculi that are present. Now we are going into the abscess cavity with the cystoscope. Here we are trying to curate out the abscess which is thick, and it is attached to the posterior wall of the prostate. Now this is the abscess cavity which is we can see that it is joined between the right and the left portion. This is the right side of the abscess. Actually, these are two separate abscesses, and this is the left abscess. We are trying to cure it out as much as possible. We immediately send the pus for urine culture, pus culture, and we put the patient on antibiotic therapy, triple antibiotic therapy. The patient is usually discharged on the next day, and more than 95% of the patients, the symptoms get relieved after the drainage of the abscess, and we remove the catheter by 5 days. So in this way, the abscess is drained, and the results of this procedure is very good, and the patients usually recovers from the ongoing illness, the infection, promptly. Thank you.